What is glaucoma? Glaucoma is often called the sneak thief of sight, but what does that actually mean? If you've been told you have glaucoma or you're at risk, one of the most important first steps is understanding what it is and how it affects your vision. Let's break it down in a clear and simple way. I'm Dr. Constance Okeke, your host. A question I often hear is, what exactly is glaucoma? At its core, glaucoma is a disease that damages the optic nerve, the cable that connects your eye to your brain. When we look inside the eye, an optic nerve looks like a donut with a thick rim all the way around. The optic nerve is responsible for carrying visual information, so when it becomes damaged, that rim of tissue begins to look thinner. And as that thinning occurs, vision loss can also occur. More importantly, once that vision is lost, it cannot be restored because we cannot bring back that damaged nerve tissue. In most cases, glaucoma develops slowly over time. That's why many people don't notice it in its early stages. So what causes that damage? One of the biggest risk factors is increased pressure inside the eye, also called intraocular pressure or IOP. Inside your eye, there is a clear fluid that is constantly being produced and drained. Like a sink with a drain that gets clogged, this can also happen in glaucoma. When that drainage system doesn't work properly, pressure can build up, and over time, that pressure can damage the optic nerve. But here's something important to understand. Not everyone with glaucoma has high eye pressure. Some people develop glaucoma even when their eye pressure is in a normal range. In these cases, the optic nerve may simply be more sensitive or vulnerable. This is why glaucoma is often described as a complex disease. It's not just about pressure. Over time, untreated glaucoma can affect your vision, usually starting with your side or peripheral vision. As it progresses, it can lead to tunnel vision and, in advanced cases, significant loss of vision or blindness. The key is that glaucoma often develops quietly, without pain and without early warning signs. Once glaucoma is detected, it does not go away. It's chronic. That's why early detection and regular monitoring are so important. The earlier glaucoma is identified, the more we can do to slow or prevent vision loss. Now that you understand what glaucoma is, you may be wondering what causes it and why it develops. In our next video in the Glaucoma Patient Journey series, we'll answer the question, what causes glaucoma?